All right, today we're diving into a really fascinating medical mystery. It's a condition called cervical angina, which is basically chest pain that has absolutely nothing to do with your heart.
You know that feeling? A sharp pain in your chest, and your mind just immediately jumps to the worst-case scenario, right? Your heart. It's a terrifying thought. But what if that pain, what if the real source of it wasn't in your chest at all?
Well, that brings us to this really strange condition. It's like a medical imposter, and a very convincing one at that. It mimics one of our absolute biggest fears. So this imposter is called cervical angina, or sometimes pseudoangina. And it's tricky because it shows up as chest pain that feels exactly like a heart attack. But the problem? It isn't in your heart at all. The pain is actually coming from a problem in your cervical spine, in your neck. Now, officially, this is considered a pretty rare condition, but it's probably just underdiagnosed. I mean, think about it. Someone comes into the ER with chest pain, what's the first thing doctors are going to do? They're going to check the heart, right? And they absolutely should. But because of that, a cause coming from the neck can just completely fly under the radar. So to really see how this plays out in the real world, let's dive into a case study. It follows one patient's incredibly long, and I mean frustrating, 2-year journey to finally get a diagnosis. So let's meet our patient. He's a 34-year-old guy, and for 2 straight years, he was just stuck in this awful cycle of symptoms. We're talking persistent pain in the front of his neck, chest pain that radiated out, a deep ache behind his shoulder blade, and even pain shooting down his outer arm. I mean, those are all huge red flags for something serious. So for 2 years, he's living with this constant pain. And for a full year of that time, he tried everything, the standard stuff, physical therapy, steroid injections, you name it. And the result? 0. Nothing gave him any lasting relief. It was just a total dead end. So of course his doctors did a full-blown cardiology workup. They checked everything you can possibly imagine, and the results came back completely negative. His heart was perfectly fine. So you have this situation where the pain feels exactly like a heart problem, but all the tests are screaming, nope, not the heart. And this is where the mystery really starts to get interesting.
Okay, so if it wasn't his heart, then what in the world could be causing all this pain? The investigation had to take a really sharp turn here. They needed to start looking for a totally different culprit in a totally different place.
With his heart officially in the clear, the doctors finally turned their attention to his neck. And these MRI scans, well, they revealed the truth. The source of all that crippling chest pain was right here, plain as day, a long, long way from where he was actually feeling it.
And here it is. This is the big aha moment. This view from the MRI just pinpoints the exact problem. You see, he had a herniated disc at the C6, C7 level. That's one of those little cushions between the bones in his neck. It was bulging out and literally pinching the nerves as they were trying to exit his spinal cord. The technical term for this is neuroforminal narrowing. Okay, so to make this super simple, think of it like this. That herniated disc is like a bulging tire, and it's pressing down hard on an electrical cable. That cable is the nerve. So the pressure creates all this static, right? Just scrambled pain signals that travel all the way down the cable. That's why he's feeling the pain in his chest and his arm, even though the actual short circuit is way back in his neck.
So there you have it. The mystery was finally solved. Now the big question, how do you fix it? Well, the answer was a really innovative surgery that promised to finally give this guy the relief he'd been searching for years.
The surgery is called a cervical arthroplasty, which is basically a total disc replacement. And it's actually a pretty elegant 3-step process. First, the surgeons go in through the front of the neck to get to the spine. Second, they carefully take out that damaged, herniated disc, the one causing all the trouble. And then third, they pop in a new, high-tech artificial disc to get everything back to normal.
And wow, just look at the results. It's so clear. Before the surgery, you can see the problem right there in his spine, and after, that new artificial disc is just perfectly in place right at that C6, C7 level. It restored the alignment, and most importantly, it finally freed up that pinched nerve.
The result was, it was nothing short of dramatic. I actually want to read you this quote directly from the case study because it's just so powerful. It says, "The patient reported complete resolution of his pain immediately upon waking up post-operation." Just imagine that. 2 years of non-stop suffering, and he wakes up from surgery and the pain is just gone. Instantly.
I know, it's an incredible story. But you might be thinking, okay, but is this just some 1 in a million fluke? And that's a fair question. Well, the researchers actually looked into that.
And it turns out, no. This is a real, documented pattern. It's just not very well known.
So on top of this one case, the authors did what's called a systematic review. They basically dug through all the existing medical research, they analyzed data from 11 different studies, and they found a clear, definitive link between issues in the neck and this very specific type of chest pain. And when they put all the data together from all those cases, a really clear pattern popped out. Get this, a staggering 87% of cervical angina patients had a herniated disc at the C6, C7 level. That's the exact same spot as our guy. So this isn't random at all, it's pointing to a very specific weak spot.
Okay, but what about the outcomes? For patients who ended up needing surgery because nothing else worked, the results are just astonishing. Across all the surgical patients they reviewed, 100% of them reported their pain was completely gone after the operation. 100%. That's an unbelievably effective cure for this very specific problem.
So we've followed this whole medical detective story. What's the big takeaway here? What are the key lessons?
Well, first and foremost, it's a huge reminder that chest pain isn't always a heart problem. It also shows why, for really complex cases, you need a team of different specialists looking at the problem. And it proves that if you only focus on where the pain is, you can miss the real cause, leading to years of suffering. And finally, for the right patient, surgery isn't just some last-ditch effort. It can be a complete and total cure.
And that just leaves us with one last thought to chew on. This poor guy's 2-year nightmare, it was solved the second doctors looked at his neck instead of his chest. It really makes you wonder, doesn't it? How many other medical mysteries are out there right now just waiting for someone to look in a totally unexpected place?